Hi guys, I'm Dr. George Michael. I'm working at First Choice Homeopathy. We have three branches, Mangalore, Udupi and Bangalore. Today my subject is cervical spondylosis, neck pain. Who are the commonly people get affected with this condition? Repeated neck movements, awkward standing on sitting positions, past history of any neck injury. So let me explain how it causes. It's basically tear and wear which cause a degeneration process in the spine. We call spine. We have it here 7 bones in the cervical, the neck region. So let me explain very clearly structure wise. So there are 7 bones are there. Here basically each vertebra we call each vertebra that's connected to intervertebral disc. So because of dehydration, it basically because of aging process that bulges, okay, reduces space and loosening of the water, and because of this intervertebral disc it gets loosening of the water, it shrinks. So that causes the spinal cord which passes from the CNS, we call brain, to the rest of the body. So that gives a compression effect on the spinal cord and the nose. So because of this we started getting all these similar symptoms of neurological deficits. Sometimes we get it numbness, tingling sensation, loss of sensation, lack of coordination, okay, and lack of control of the bowel and bladder habits. Sometimes occasional headaches we get it. So these are the common symptoms we get in the early stages. Now what happens if you neglect these cases usually? So if you neglect this case, basically that may cause severe cervical compressions, otherwise severe compression of the spinal cord. So that may cause the pinching towards the nerve roots which spreads to our rest of the body, the peripheral regions. So in order to do that we need to be very careful when the evaluation of disease factor itself. Now how we get the diagnosis? Basically in the beginning phase it get diagnosed to the earliest feature itself. So when the disease get more deepened, we have the X-ray findings, MRI, CT scan, myelogram, okay, nerve conduction studies. That gives the exact alignment of the bone. So is there any formation of the bone spore? We call, when this evolution happens, there's additional growth of bone in the spinal cord that may cause the compression effect on the spinal cord. So second time, the narrowing of the foramen, we call the spinal cal, that also causes the pinching on those. So in order to reduce all these symptoms, so we have the two type of treatments. One thing is prophylactic. That is in the beginning of the phase. When there is a tear and wear, we call degenerative process. We need to prevent this stage by strengthening of the ligament which connect to the bone, okay, by minimizing the rubbing of the bone. So otherwise to prevent the erosion of the cartilage. So basically our mainly focus to prevent this basic depathology. So now what are the treatment comes when this already discovered? Now basically things to prevent the like complications. So if the disease get evolved continuously, there are a few things like spondylotic changes we call it as, otherwise progressive neurotic changes we call it as. So ultimate focus of the treatment to prevent the surgical indications, otherwise invasive procedures. So there are few homeopathy remedies like, please don't take these drugs on the counter. We call Symphytum, Ruta, Rustox, so Medurinum. So these medicine you need to be take under guidance of homeopathy doctor. So right now I'll wind up this condition. I'll be get back to one effective subject. So you can contact me on this number 8222165971 for the query.